Well, Dr. Morgan, we know that you're celebrating 38 years of medical practice. That's right, and delivered more than 10,000 babies.
Yes.
What a journey has that been?
It's been great.
Rewarding career?
Enjoyed it. Loved it.
Yeah.
Yes.
Yeah,
Missed it a little bit.
Yeah, but now I think you've got some exciting focus going forward in
Yes.
terms of working with women as it relates to other issues besides having baby.
Sure.
One being hormone replacement therapy. Who is a fit for that as far as like when you're with patients that might be a good fit for having hormone replacement therapy?
I mean, classically, we would do menopausal ladies. So they get 51 years old and start missing their periods, have hot flashes, night sweats, couldn't sleep, anxious, depressed, and they're good. However, we then found out that women in their 30s, they will have testosterone deficiency, and they have benefited from very well. So even women who are not menopausal, there has had as much improvement as anyone. So it's been great.
Okay. So what, if a woman has certain symptoms, you mentioned like hot flashes, but what are some other things that might indicate hormone replacement therapy would be good?
Well, for menopausal women, it's hot flashes, night sweats, anxiety, depression, moodiness, brain fog, can't sleep. All right. But then the premenopausal, the 35, 40-year-olds, they'll come in and they'll have a lot of issues and they're anxious, stressed, depressed, and in the old days they would say their hormones were out of whack, and so they'd have normal periods, so we're learning, no, your hormones out of whack, you're just depressed, so we'd put them on antidepressants. But in retrospect, their hormones were out of whack, and it was usually low testosterone.
Okay.
And when you did that helped their anxiety, it helped them tolerate others, libido, all that. So they got to, basically you put the same hormones that a 20-year-old would have.
Okay.
And when you're 20, you're pretty carefree and everything's good.
Well, as far as the kinds of hormone replacement therapy, I know you have used several different ones, and is there one in particular that you think is better than the others? Or?
Well, it's whatever they work well with.
Okay.
It depends on if they've been on something in the past. I mean, classically, there's oral medicine that can be helpful. We have patches. We do a lot of these bioidentical pellets. That's where many of these people do the pellets these days.
Okay.
And this is it's a pellet that you put underneath the skin. It's about the size of a piece of rice.
Okay.
And it lasts for 3 to 4 months, and they do very well with that.
So there are a number of options.
Yes,
depending on what you're...
Creams, patches, peels, everything.
So I guess as you make this transition to not delivering babies, but helping women with their other gynecological needs, this will be a focus for you.
Yes.
One of them. Yes.
Great.
Yes. Well, in terms of your faith, has that been a part of your journey as a practitioner, as a physician?
Absolutely. It's just kind of interesting, and as you think about your maker and how all this changes, and as we get older, and the changes your body goes through. And so, yeah, it's been amazing.
Yeah. Well, thank you so much for taking time to be with us today.
Yes, sure, absolutely.